And thanks for tuning in, guys. Today, we're going to have, just a very lighthearted conversation about something that I encounter in my practice very, very frequently, the so-called double chin or this excess submental, either skin laxity or fatty tissue. So let's kind of dive right into it and see what we can do about this particular problem. So the chin and the jawline are, very aesthetically important components of the face, especially nowadays. A lot of increasing popularity on ways to contour this area, and for obvious reasons, as you can see, a nice chin and a nice jawline essentially defines the face and really gives it the frame and the contour that it requires. There are three essential features of this area that require maintenance. And the first is definition. Okay, a well demarcated jawline separating the face from the neck is always viewed as a very attractive thing. And over time and genetics and things like that, that demarcation can sometimes blur. The second is contour. Okay, the shape and the size of the jawline and the submental region also plays a big role. There are some, differences in terms of how what people prefer in terms of stronger versus softer contour or whatnot. But generally speaking, that shape and that contour is very, very important. And then finally, just the simplicity of it. You want an essentially smooth curve, okay, from the angle of your mandible to your chin, and you don't want it to be a broken line or a wavy line or blurry or indistinct. So it just needs to be simple. It needs to be sharp, and that usually is the requirement for that area. So how does this area tend to age over time? Well, it's pretty much a complex interplay between the skin and the muscle and some fascial layers, as well as the development of fat in especially this so-called submental area, or the area that we tend to consider the double chin. But basically, it boils down to two major factors, and sometimes a combination of both. Skin laxity, so looseness of the skin, that is due to loss of collagen over time, either through just intrinsic aging processes or sun exposure and exposures to external factors. And then just excess fat. The submental region is actually a very resistant area to standard fat reducing methods like lifestyle changes and exercise and stuff like that. And so it's very easy to accumulate a little bit of excess fat in that area. And very frequently, both of these problems present at the same time. So this is an example of, looser sort of skin. It's very, very common. Essentially everyone, eventually we all face this. And sometimes it bothers people just due to the cosmetic appearance. As you can see here, there's looseness of the skin without too much necessarily extra fat, but you can see how into the lower part of the neck, there's excess wrinkling and then sort of folding of the skin. And that looseness and that folding can be sometimes displeasing and unwanted. The other classic scenario is just, excess fat. That's the classic double chin where the skin quality is fine, actually, but there's just a lot of fat there. And sometimes people don't like that for aesthetic reasons as well. And then finally, maybe the most common situation, especially as we get a little bit older or just genetic factors are at play, is we have both the laxity of the skin and accumulation of excess adipose tissue. For example, in this case here, you can see the folds and the laxity, but also the increased bulk and just the girth of the neck is evident here. And all of these things are combining to essentially obliterate the jawline. So we lose the contour, we lose the demarcation, the definition, we lose that simplicity of that structure. And it also starts to obscure the chin. And these features sometimes are not what we want. So what can we do about that? Well, now that we know that it's kind of skin laxity and excess fatty tissue, then the solutions become pretty obvious. First, we want to tighten the skin. Okay, and there are a variety of different ways to do so, some of which are FDA approved and have been around for quite some time and have been tried and true. And then finally, we want to reduce fat. Okay, and again, there are ways that can very reliably do so. I like to, when I talk about body contouring, I kind of like to group things into three major categories. The first being kind of the non-invasive category. These are techniques, either energy devices or injectable treatments that essentially are minimal to no downtime. They don't involve any invasion of the skin. They don't involve any surgical procedures or cutting or scarring or anything like that, and are essentially very, very safe. Okay, and these options here, the Ultherapy, the Thermage, the CoolSculpting, the Kybella, they all fall under that non-invasive category. Okay. The second category is the so-called minimally invasive category, where there is some invasion of the skin. There is some sort of procedure that's going on, but it's designed so that the actual severity or the aggressiveness of it is as limited as possible. And so these are things like traditional liposculpture, okay, which is done under what we call tumescent technique, and it's just essentially a dilute solution of lidocaine. We numb the skin, and then we enter via these tiny little punctures in the skin, and therefore can access the fat. And then other energy-based things like ThermiSculpt, which is a combination of this liposculpture technique with a radio frequency device that delivers heat and therefore stimulates collagen and reduces fat. So those are the two major sort of categories, the non-invasive and the minimally invasive, that we tend to do as dermatologists. And they tend to be very popular because the non-invasive ones, obviously, no downtime and very safe. So they're very, very popular. Whereas the minimally invasive ones, they have their role because they're very effective. And so, as long as we keep the downtime to a minimum and the side effects acceptable, then the trade-off in terms of the result that one can get from these minimally invasive approaches is usually very pleasing. There is a third category, which is the full surgical category. That's essentially a full neck lift, which I'm not going to go into here, and it's kind of beyond the scope of this talk here. So let's kind of dive right into it. Skin tightening. And the two major players in this space are what's called Ultherapy and Thermage. Okay, and I'm going to describe these a little bit to you. Ultherapy is what we call a focused ultrasound. Okay, and it combines that focused ultrasound with the ability to visualize exactly what we're treating in real time via ultrasound. Okay, and it's one of the main FDA approved ways to non-surgically lift the face, the neck, and also for chest wrinkling. Essentially, what happens with therapy is you can see in this diagram, it combines the capabilities of ultrasound that we all know in terms of medical imaging. You can use ultrasound to see inside the body, but focusing this ultrasound energy to very specific depths in the skin. As you can see here, that green line is the so-called fibromuscular tissue. It focuses these ultrasound energies at that level and stimulate new collagen growth because of the heat that is produced there. And when you stimulate new collagen growth at that level, you induce a very nice sort of tightening effect while sparing all of the surrounding skin and sparing the surface of the skin too, which makes it completely non-invasive and with minimal to no downtime. On the other hand, there's something called Thermage, which is a similar concept. We're instead of using focused ultrasound energy, in this situation, we're using radio frequency energy. And this energy, again, is transformed into heat in the skin. And the treatment begins with this cooling effect so that the surface of the skin is protected. And then the radio frequency energy is delivered in a targeted approach that heats the skin to a certain degree. And that heat, again, is basically what stimulates the new collagen growth, which then lifts and tightens the skin. So ultimately, the concept is the same between these two devices: deliver heat and stimulate collagen and lift and tighten. The way by which they do it is somewhat different, but both have their uses and are excellent treatments for those individuals who have a little bit of skin laxity to their neck. We've done many studies on both of these technologies. I've taken a sample of them here. This one where we actually evaluated all of our therapy patients and kind of looked at them over time and trying to evaluate, the effectiveness of the treatment. And we found that, it was really quite effective for upper face, mid face, lower face, and the neck. And we were able to notice statistically significant improvements in all of these categories. And as you can see here, the non-invasive approaches are subtle, okay? But in this patient here, you can appreciate that the contour of that under chin area, that so-called submental region, initially started out with a little bit of skin laxity, certainly not much at all, but just a little bit, okay? Enough to be bothersome. And you can see how 90 days after a therapy treatment, already we're noticing some pretty appreciable tightening. And then a year later, usually it takes about 6 months to a year or so for that tightening effect to fully mature. And ultimately, the result is very natural and usually quite pleasing. What I find with many of these non-invasive technologies is that they're really great for maintenance and prevention. And so their power really starts to shine when you do a treatment and then you maybe do a treatment once a year or so, maybe twice a year, something like that. And that can really build this cumulative effect in a very non-invasive way that helps the skin to age very naturally and gracefully over time, essentially slowing or freezing time as much as we can. Another study we did was to actually compare Thermage versus all therapy. And we did a split face study. People allowed us to treat half of their face with Thermage and half their face with all therapy, interestingly. And then, of course, at the end of the trial, we balanced it out. But ultimately, we basically found that these two technologies, although they utilize very different modalities, ultimately their clinical effects are very similar. And we found no difference between the two sides in terms of lifting and roundness and skin tightening and neck laxity. We found them to be very, very similar, which was encouraging actually, because both technologies seem to work quite well. And as you can see here, this was a split face treatment, but there's no asymmetry, and the neck is tightened. There's a little bit of a lift to the face as well. So that's kind of the skin tightening approach. This is kind of reserved for those individuals who have just the beginnings of maybe threatening to develop a double chin type appearance because the skin is getting a little bit looser and laxer. And so if we capture it at that stage when it's still a little bit early, then we can really affect some very nice change and then maintain for a very long time after that. The second sort of category is fat reduction. And this is when we get true double chin. Okay, there's excess bulk there that it cannot be tightened away, and it actually has to be targeted and reduced. And thankfully, actually, there are a variety of different methods that we can use to target and reduce the fat in the submental region, including CoolSculpting and Kybella, which are non-invasive technologies, and then these Thermage and Liposculpture techniques, which I will describe in just a little bit here. So first of all, the key with dealing with this area, honestly, is to consider the anatomy. Now, that's not a big concern, of course, for a patient coming into to their procedure. But for us as physicians, we have to always respect sort of first principles and have a very detailed understanding of exactly what's going on in order to deliver these treatments in a very safe and effective way. And this is the classic sort of surgical anatomy. But to boil it down, basically, there is a muscle. It's called the platysma, and it's the thin sort of sheet-like muscle that covers the entire neck. And if you kind of stick out your teeth and stuff, you can see these little bands. That's basically the platysmal muscle. It essentially covers and surrounds this discrete fat pad called the submental fat pad. And that's a discrete compartment that sits just underneath the chin, and it exists both in front and behind the platysmal muscle. And that's the discrete fat pad that leads to the development of the double chin appearance when it gets either too large due to genetic reasons or because of aging and other factors. So essentially what we're trying to do is target that discrete fat pad and modify it in some way. And there are ways to do so, including CoolSculpting. CoolSculpting is one of the most popular non-invasive body contouring methods that we have, and it's really quite ingenious. And once upon a time, and actually this has been known for a long time amongst dermatologists, is that if you expose the skin to very cold temperatures, then in some cases you can actually induce a destruction of a localized destruction of the fat in that area due to a process that we call peniculitis, which is basically just inflammation of the fat in response to cold temperatures. And in dermatology, there's a very well-known phenomenon called popsicle peniculitis, where children would suck on these popsicles and then get these little caved-in spots on their cheeks because the cold from the popsicle stick would actually cause this inflammation in their fat. And so we managed to leverage this phenomenon into a technology that then could target fat specifically and reduce it. And that was basically the birth of CoolSculpting. Because at those temperatures that fat is sensitive to, in fact, the rest of the skin and the muscles and everything else is essentially pretty safe. They don't get really damaged at that temperature. It's really only the fat cells that are highly temperature sensitive and therefore respond to the cold. And so that was a very specific way to reduce fat. And then CoolSculpting developed over many years, but now we have this Cool Mini, and that's what we can target with the submental fat. The Cool Mini applicator essentially attaches to the submental area and sucks up that fat into the applicator and then applies a controlled cooling that then causes a very controlled reaction within the fat that eventually results in its disappearance from the area. And so as you can see here, this was published several years ago, but it's a tried and true technology. There's nothing surprising about this. Again, the advantages of something like CoolSculpting, otherwise known as cryolipolysis, is that it's non-invasive. So you can basically do it and you have no downtime and minimal to no risk. The disadvantage of CoolSculpting, of course, is that because it's non-invasive, it's not going to necessarily, dramatically transform the areas, and not necessarily going to do a whole lot for skin laxity either. Okay, so those are things to bear in mind when you're kind of approaching your decision in terms of what you want to pursue in collaboration with your physician. The other more recent development is an injectable technology that actually dissolves fat. And this is called Kybella in the US. And the chemical is actually sodium deoxycholate or deoxycholic acid. And we found that actually when we use this substance and we inject it into fat, it actually dissolves the fat. It disrupts the cellular membranes that keep fat together. And so when these membranes get dissolved, the fat actually undergoes a process by which it gets eliminated from the body. And this became actually a very interesting and elegant way to target small focal areas of fat, because the needle is very precise, and you can deliver this type of treatment into very precise locations and small fatty pockets. And so it's literally ideal conceptually for an area like the submental region, which is a discrete fat pad that tends to grow a little bit too much. And we were actually involved in the clinical trials with Kybella that got it approved by the FDA. I was actually one of the injectors in that trial, and it has proven efficacy. And once again, the advantages of Kybella are that it's a non-invasive treatment, so there's no cutting, no scarring, no nothing. But there are some caveats with Kybella as well, in terms of, it usually requires a number of treatments in order to achieve the final goal. And these treatments are usually spaced out 6 to 8 weeks apart. The number of vials that are required per treatment is also an issue and depends on patient characteristics at the time of consultation. So there are certain factors that, need to be considered whenever we think about these types of treatments. And it's very important to sort of have a very collaborative relationship with your physician so that you can, get that education and be informed in terms of what these treatments actually do and how they can benefit you, and in terms of what their side effects may be, so that you can make the best decision for yourself. But the Kybella has been around and it's been published. We were involved, like I said, in the clinical trials. And as you can see here, again, it's not going to be a phenomenal sort of difference, but you can definitely appreciate a reduction in this submental area, as well as a sharpening of that angle and a more defined jawline after treatment with Kybella injections. So those are the non-invasive ways to reduce fat. Again, advantages are that they're safe and minimal downtime. The disadvantage being that they aren't as effective as a more invasive approach. And so let's talk a little bit about minimally invasive approaches, of which the two have kind of risen to the top. One very traditional is liposculpture, been around for a very long time, invented by a dermatologist, at least in its current form as tumescent liposculpture back in the 80s and 90s. And it's something that we've been doing a lot of over the last 30 years in our practice. And then more advanced liposculpture techniques like ThermiSculpt and laser-assisted liposculpture, which basically use these energy devices to enhance and augment the ability of the traditional liposculpture method to basically tighten skin and remove fat. So this is a very common sort of situation where we have excess fatty tissue kind of in a focal area like the submental region. And in this kind of situation, the skin quality is very good. Traditional tumescent liposculpture is perfect. And it is a very minimally invasive procedure. These red dots here denote the points at which we essentially just take a little needle, poke a hole in the skin, and then enter the skin with these very tiny little what we call cannulas. And these cannulas essentially access the fatty compartment under local anesthetic. So, you feel nothing except maybe a little bit of pressure and some pulling and tugging during the procedure. And it's a very gentle procedure that can be over and done with within 30 to 45 minutes. And the final result usually tends to be quite pleasing. As you can see with this fellow here, he achieved some nice contour, some nice definition to the area after a single liposculpture treatment. And the downtime, you may think as a surgical procedure, is like, oh my God, how's the downtime? It's actually very acceptable. Usually what happens is that there's maybe some bruising and a little bit of swelling to the area, but that goes down quite quickly, maybe within a week or two. To be honest, the majority of it typically resolves. And then after that, it's really just kind of your body processing the procedure and removing the fat, the remaining fatty tissue, and tightening up the skin. And that is a gradual process over several months, but during which time you look perfectly normal. And in fact, those gradual improvements have the additional benefit of, you kind of just fly under the radar. It's like, you're doing a new exercise program, or you're doing a nice healthy diet or something like that. And the area very naturally starts to improve. So that's traditional tumescent liposculpture, one of the most effective and reliable techniques to contour the body and contour specifically this area. However, there are situations where there's skin laxity and excess fatty tissue, and so traditional liposculpture sometimes is not able to necessarily tighten the skin as much as we want. And theoretically, there can potentially be a risk where if you remove too much fat and the overlying skin quality is not sufficiently good, then you can actually increase the risk of skin laxity because the fat has been removed. And so that's why we developed other technologies that tighten the skin and remove fat at the same time. And Thermi is one of them. Basically, it's a very innovative technology whereby we can take essentially a probe. Okay, it looks kind of like this, and this is just a schematic of the skin and the fat. And we insert this probe into that fatty layer, the submental fat pocket, and we deliver heat into that area via radiofrequency energy. And again, this is all done under local anesthetic. It's a day procedure that patients drive themselves to and from. I just did one this afternoon, and the surface of the skin is monitored constantly, okay, because the temperature of the surface of the skin needs to be maintained at a certain level to be safe. But that's done with an infrared camera, and it's a very gentle and effective technique. And while we're in there with that cannula heating up the fat, we can actually remove physically some of the fat as well in a micro liposculpture type of technique. And so these types of energy-assisted liposculpture contouring methods have the added benefit of reducing the fat effectively, but also helping to tighten the skin because of that heat, which stimulates collagen. And so here's a situation where this individual has mostly loose skin. Okay, there's not a lot of fatty tissue going on. It's mostly loose skin. And so in this case, we elected to just use the ThermiTight procedure and not do any liposculpture in the area. And as you can see, with just ThermiTight, the contour improves significantly. And not only that, but the jawline becomes much sharper, and there is zero visible scar afterwards. And the incision, or the insertion site, if you will, was just underneath the earlobe and hidden underneath the jawline. But you can see in these photos, they basically heal up and vanish eventually with time, so that it is truly, in almost all cases, a scarless procedure. In situations where you have a little bit more laxity and some excess fatty tissue, that's where ThermiSculpt with micro liposculpture comes in really, really handy. Again, it's completely non-invasive, it's completely done under local anesthetic, but you can see how when we physically remove that fat and combine that with skin tightening, we get a beautiful retraction of that skin underneath the chin and a much better jawline and a significantly reduced skin laxity. It's certainly not perfect. Okay, these are unretouched photos, obviously, so to show you a more realistic kind of impression. But this is certainly a significant improvement and still very natural. The patients still look like themselves as opposed to looking radically different or changed. And sometimes that's very desirable. Again, in this situation here, a little bit of combination, skin laxity, excess fatty tissue, and once again, a scarless procedure that essentially can define the jawline and reduce that submental area very, very nicely. This type of result you're not likely going to get with a purely non-invasive approach. Okay, but the trade-off is that there's a little bit more downtime, bruising and swelling for maybe about a week or so after the procedure. Sometimes, we encounter situations where there is just too much skin laxity, okay? And these tend to be situations where the discussion is, what are your thoughts in terms of, neck lift and stuff like that. And that's something that you really need to also have a frank discussion with your physician, because if your goals are such, and, you need to achieve certain results, then you need to be informed of all of the options that are available to you so that you can get what you need. These three patients here, they didn't, they were not at all interested in pursuing neck lift. And so I ended up doing the Thermi procedure on them. But you can see that, there's still significant laxity that remains even after the Thermi procedure. But, they ended up all being quite pleased with how things ended up going, just because the expectation was set correctly and they did not want to do anything more aggressive than a Thermi procedure. So those are kind of the nuances that you need to run through in your mind and in collaboration with your physician when you're considering treatment for this area in the future. So kind of in summary, the two things that we really need to do are tighten up the skin and reduce the fat. And if we can do both of these optimally in a safe and effective manner and combine these two things together, that's usually when we get the most powerful and pleasing results with submental contouring and reduction of double chin. Well, thank you very much. I hope that was somewhat entertaining.
That was great. Thank you so much. I saw a lot of you joining after Dr. Wu started. So I just want to tell you that we did record this and we'll send this out to everyone who would like to see the recording and what he said in the beginning. Next time, I guess I'll wait another minute or two before we get started. Anyhow, but thank you so much, Dr. Wu. That was really helpful. This is the time that Dr. Wu is now available for questions. So if anyone has any, would you start populating them in the Q&A feature here on Zoom so we can, so Dr. Wu can help. And in the meantime, I am going to close down your screen if you want to stop sharing here, and then we will, where are we? And then as soon as we get through some Q&A, we will do our giveaway. So our first question is, what is the typical recovery time?
Okay, great question. That's one of the most important questions to ask. And it depends on, of course, what we're doing. So if you're talking about the non-invasive skin tightening procedures like all therapy and Thermage, the recovery time is almost nothing. You'll have maybe a little bit of redness for a few hours, maybe a mild degree of swelling that you will notice because it's your skin, but other people will not. And then it's usually a little sore, it's a little tender. Okay, so it's more of a feel than actual visible downtime. So that's with the non-invasive skin tightening stuff. For things like CoolSculpting and Kybella, okay, with CoolSculpting, especially Cool Mini, it's not uncommon to get significant bruising after the procedure. And so that can be cosmetically, undesirable and can constitute downtime. But other than that, there's not a whole lot of recovery required for Cool Mini. And then with the Kybella, though, this is an important thing to talk about with your physician, because in the initial treatments with Kybella, there is the possibility that you will get significant swelling. Um, and the swelling can, even exceed your initial sort of double chin, and that can be very displeasing if you're not prepared for it. And so we noticed in the clinical trials for the first 3 treatments of Kybella that was the trend. After the fat has been reduced to a certain level, then that degree of swelling tends to reduce significantly, and it no longer is a problem. But for the first couple of treatments, you can be prepared to experience some sort of swelling, which will be factored into your recovery time, and it can take 1 to 3 weeks sometimes for that swelling to reduce. In terms of lipo and thermie and stuff like that, the main recovery period is in the first, I would say, 3 to 5 days. Where I have all my patients wear a little chin strap and a little neck tape just to kind of support and hold the area together. And it'll be sore, and there'll be some tenderness and bruising and a little bit of swelling. And most patients, honestly, after the first 3 days are completely functional in terms of their daily lives, but cosmetically may require a little bit more time to recover, up to 1 to 2 weeks. And so what I usually see is that by about 2 to 4 weeks after the procedure, the swelling has been reduced about 80%, 70 to 80%. By about 3 months after the procedure, that swelling is further reduced to about 90%. And then 6 to 9 months after the procedure is when you really get the final retraction and tightening. So that's kind of the timeline that you can expect with this type of procedure. Liposculpture on the neck, just as a final word, it's really very different than body liposculpture. When we do body contouring, the downtime is significantly more because you feel much crummier. But with the neck, you can really, it's very, very tolerable. It's a very minor procedure and gives very good results. It's one of my favorite places to work on, actually.
Great. Okay, so I guess a good segue that's into the next question of how long do each of these treatments hold up? Do you need touch-ups? How long will the results last for?
Yeah. So again, it depends on if we're tightening the skin or if we're busting fat. So in general, if you truly destroy a fat cell, it doesn't tend to come back. Okay. And so the caveat there is truly destroy and how much of them you destroy. So in the case of Kybella, okay, where you're inducing a very significant inflammatory reaction to the area, you are truly destroying a lot of those fat cells, and they're not likely going to return. So the result is very long lasting, barring, of course, significant changes in weight. And by that, I mean, 20 plus pounds of weight fluctuation can, of course, overcome anything. CoolSculpting is a similar sort of scenario, but you destroy much less fat with CoolSculpting, and truly like destroy it. And so that sometimes repeat treatments will get you to a certain point, but after you do achieve that certain point, it does also tend to be very long lasting. Something like liposuction and thermie and liposculpture, these ones are very, very long lasting because you're physically removing the fat. So the cells are gone completely. And for the body to grow completely new fat cells is actually very difficult. So that can be a very, very long lasting procedure, which kind of adds to the value of it. It's kind of a one and done, and it's very long lasting. For the skin tightening stuff, that lasts maybe quote unquote lasts. It's hard to say because the collagen that's stimulating the skin lasts indefinitely, but time moves on and collagen continues to degrade. And so that's why I recommend once a year as a reasonable schedule, and sometimes even twice a year for these treatments to really maintain their effects.
Great, that was really helpful. All right, 2 a little bit more specific questions. They're not about all of them. My husband had 1 treatment with Kybella. How many treatments will he need?
Yeah, so this is the key question all the time with Kybella, and it has to be an accurate assessment needs to be given by assessing the patient at the time of treatment. I can give you some ballparks. So it really depends on how much product was used per treatment, okay, and how much fatty tissue existed at baseline. In the clinical trials where we selected for people with significant amount of submental fat, we did a protocol that used 5 vials of Kybella per treatment for 5 to 6 treatments spaced 6 to 8 weeks apart. Okay, that was the way that we did it in the clinical trial. In real life, I tend to average, maybe 2 to 3 vials per treatment for maybe 3 to 5 treatment sessions. And so in real life, it's reduced, and it's always like that. The clinical trial always overtreats in order to really achieve certain goals. But that's, I think, something that can be, estimated. On average, 2 to 3 vials per treatment, 3 to 5 treatment sessions.
Okay, great. Sorry, dog barking. Zoom problems. Okay, last question before we get to the giveaway. Will that popsicle stick or CoolSculpting method work for older adults? And are there any age restrictions for any of these procedures?
Yeah, really great question. So there is absolutely no age restriction for CoolSculpting. Fat is fat, and it will technically work on any area that has a sufficient amount of fat to be, filling the applicator. And that's really the discussion and the evaluation needs to be performed by your provider at the time of assessment and treatment. The issue, though, is that the older we get, the more skin laxity we get. And CoolSculpting will not really, to a dramatic degree, address skin laxity. And so again, be informed about that, so that you're not just busting up fat. It's safe, and it probably busts up fat, but you may have skin laxity that is contributing to the problem, and that will detract from your final result. Did I answer that question? That was
Yeah, I mean, are there any age limitations for any of them? I think.
Right, yeah. So for tumescent liposculpture of the neck specifically, there is almost no age restriction, as long as the patient is reasonably healthy. Truly, it is a completely non-invasive procedure. There's no systemic medication given. It's just lidocaine. And so unless you're severely unhealthy with kidney issues and liver problems and stuff like that, it's not likely going to be ever a problem.
Got it. Okay, great. So at this time, let's do the giveaway. And then I have one more question that we can answer while people are entering their information. So if you could come to the chat, and you can send a private chat if you would like, but can you please put in, there are some more questions coming in here. Please put in your name and your email, just in case you didn't, you're coming in under a different way that you registered. We want to make sure we have a list of all the people here so we can choose a winner. So in the chat, thank you. I see a lot of you doing that now. While you're putting that information into the chat, I will ask the last couple questions here. So is there any sort of cost range for these treatments?
Yes, there is. CoolSculpting is done is costed per applicator. Okay, and so a Cool Mini treatment in this area typically involves 1 to 2 applicators required to cover the area. Okay, and each applicator, I don't know the exact, I don't remember exactly, but it's somewhere in the range of $600 or $700, something like that. Okay, for Kybella, it depends on how many vials that are used, and so the number of vials will obviously determine the treatment total treatment cost, as well as the number of treatment sessions required. Each vial runs somewhere in the range of $600-ish or so, and so that's how the calculation is made there. For liposculpture and Thermage sculpture, that is entirely dependent on the assessment of the patient at the time of treatment, depending on how much work is required and exactly what needs to be done. And then the cost is determined via those factors. A ballpark range for that is somewhere, I would say, in the range of $3,000 to $5,000, something like that, as a very, very rough ballpark.
Great. And I'll just follow up with that to remind everyone that one of the best things about Dr. Wu and at Cosmetic Laser Dermatology is that he offers complementary consultations. So if you might be wondering, like, is Cool Mini better or Thermage, or would Ulthera work, or do I need lipo? You don't need to guess. You can just schedule yourself a complimentary consultation with Dr. Wu. And if you're out of town, he also offers consultations virtually. So I think, that would be great. And he can definitely tell you exactly which treatment he would recommend if there's going to be more, more than one, and the full cost. So it's a great, it's a great way to answer that question. So let's see, I think everyone is almost finished adding their emails here. So just to protect some HIPAA privacy for all of you, we will choose a winner and announce it tomorrow and reach out to you first. And if you're comfortable with us announcing your name, we will do so on social media. So unless there's any further questions, which I don't see. I really appreciate your time, Dr. Wu. A lot of people are saying thank you, great presentation, really helpful information. And I will stay on since a few of you are still putting your emails here. But otherwise, thank you so much, Dr. Wu. I know this is an area that a lot of us struggle with, and it's really nice to hear about all the options and see some of the actual results that are really, able to get. So thank you so much, everyone, and have a great rest of your evening.
All right, guys, bye.
Bye.